Your doctor has prescribed Breg VPULSE to help you achieve a complete and comfortable recovery. Breg VPULSE delivers 3 distinct therapies. 1, compression on your calves to prevent the formation of blood clots, also called deep vein thrombosis. 2, motorized cold therapy over your operating site to reduce discomfort and swelling. And 3, compression over your operating site to further reduce swelling. Your doctor will provide instructions regarding which therapies to use, how many days and hours per day to use your VPULSE, and how frequently you should take breaks and inspect your skin. Breg VPULSE can be cold enough to cause serious injury, including full skin necrosis. Read and understand all warnings and instructions provided in the user's manual prior to using the device. Do not use the VPULSE if you have not received or don't understand your doctor's instructions. This video will explain how to operate your Breg VPULSE. Your VPULSE system comes with a container, 2 calf wraps, a tubing set, a power wall adapter, ice bottles, and a user's manual. You will also receive 1 thermal compression pad specific to your needs. First, open the container by pulling back on the white tab with your thumb and twisting the handle in the direction of the arrow. Remove the ice bottles from the container. Then fill the container with cold water to the water fill line. Never operate the system without water. You have the option to add frozen water bottles, ice cubes, or a combination of both. If using water bottles, freeze for a minimum of 6 hours and then place into the container. If using ice cubes, fill to the ice fill line inside the container. If using both, then place the frozen water bottles into the container first and then fill the surrounding areas with ice. Using a combination of the frozen water bottles and cubed ice will maximize your ice time. Once the container is filled, close the VPULSE by replacing the handle, aligning the dot on the thumb lock to the top cover, and rotate clockwise, listening for the positive locking click. Center 1 calf pad behind your calf with the connector toward the ground. The instructions will be facing you. Wrap one side of the pad around the front of the leg and then secure by wrapping the 3 fingers around the front from top to bottom. Adjust so the pad is snug but not too tight. Repeat with the other calf. There are several different thermal compression pads available to cover the knee, shoulder, foot and ankle, hip, and back. You will receive the pad applicable to your procedure. Each pad has printed instructions on the pad. The connections on the tubing set are color-coded and keyed. Connections can be made only one way, and you will hear a click sound when fastened properly. Tubing is held together by straps that can be positioned as you choose. Attach the connectors to the tubing set to the connectors on the VPULSE. Confirm a secure connection. Connect the other end of the tubing set to the appropriate pads. And confirm these connections as well. Plug the adapter into the unit and the wall. The system will perform a self-test indicating it's ready to go. There are 3 separate therapy buttons and a center start-stop button located on the front of the VPULSE container. The cold therapy button is on top with a snowflake icon. It illuminates white. The calf compression button is on the bottom right with a calf wrap icon. It illuminates orange. The wound compression button is on the bottom left and depicts an icon of a person with various joints circled. It illuminates blue. Select the therapies prescribed by your doctor and then push the center start-stop button to begin therapy. The start-stop button will illuminate green when the system is running. You can change the settings only when the system is stopped. Press the start-stop button to turn off the system. Add or change your therapy selections and then press the start-stop button again to restart. If the unit is unplugged while running, you will need to plug it in again and press the center start-stop button twice to restart the device. The device will remember which therapies were being used prior to shutoff and continue with those therapies. The sounds from the VPULSE are the compression cylinders cycling off and on and the motor circulating the water. You should feel the cold water begin to circulate in the cold pad. Each pad will begin individually inflating and deflating in succession. The entire circuit takes a little over a minute. It may take several cycles before all pads are fully inflating and deflating. When using this system, check the skin underneath where the pads are applied as instructed by your doctor. Discontinue use and contact your doctor if you experience any adverse reactions, such as increased pain, burning, increased swelling, itching, blisters, increased redness, discoloration, welts, or other changes in skin appearance. Remove the electrical cord and fill the empty container to the max fill line with fresh, room temperature water. Do not use any cleaning solutions in the water reservoir, as these solutions could damage the water pump and therapy pads. Replace the handle and connect power. Operate the system for 10 minutes and then empty the water reservoir. For the outside of the VPULSE, use warm water with mild detergent, including Lysol, 70% isopropyl alcohol, Sidex, or 10% bleach solution. Do not store the VPULSE with water in the container or the pads. Begin by removing water from the pad by rolling the pad up while still connected, or place the pad above the unit while still connected. Squeezing the water back into the container, disconnect the hoses. Then empty the container and ice bottles. Allow the unit, pads, and water bottles to air dry completely before storing. To order additional components, such as ice bottles or pads, please call Breg Customer Care, 760-795-5440 or 800-321-0607. To learn more, please visit breg.com.